We had an opportunity to work on a very, very exciting project which was going to change how we interact with the patients on the bedside. The university had plans to implement at our new facility a bedside platform for patients to interact with the treatment teams. And we saw this as a great opportunity to be able to provide food services through this platform. So this platform allows the patient to interact with the nurse, also has their chart information regarding their labs. They're able to communicate to the treatment team in terms of signs and symptoms, or send messages, or tee up messages or questions for the next time they come around, and to have a spot on that platform so that they would be able to interact with the nutrition and food services team was very, very exciting. So using OneView is easy for the patient. They use their tablet. The tablet is easy to use, and you can choose the foods that you want. So one of the other challenges was to make sure that we were able to help the patient navigate through their restrictions. Because we use a room service style of menu, the patients could choose multiple things and very easily be out of compliance for their carbohydrate or sodium levels. So the way we worked around this issue is to work with OneView, and they were able to put in some coding on their end to help us capture and total the specific nutrients that we were interested in the diet order. So for example, for carbohydrate controlled diets, we were able to calculate the totals on the sidebar of the screen, and so the patient could see the nutrition information of the items that they were picking, as well as the highlighted carb, which would be the nutrient that needed to be controlled, and they could see that they were going over or under and adjust their choices so that they were compliant with the menu. One of the challenges we had was to address, how do people with other languages use the system? And we do have, being in the Bay Area, a hospital which admits patients from a lot of different places. We have a significant population speaking Spanish and Chinese, so we decided to narrow down on the top 2 or 3 languages, and we're finally able to get the menus translated into Spanish and Chinese and Russian, and use them effectively to place their meal orders. So since we started using OneView, we have been able to realize some real time savings. The number of calls that the call center has to address have been lower, because we have on a given day 30 to 40% of the patients using OneView to place their meal orders, and this has definitely helped with our call center staffing. One of the things that I'm really proud of working here at UCSF and with an amazing team of dietitians and managers is to be able to use technology to help our processes become more accurate, more timely, more responsive, and drive patient satisfaction.